Hi, everyone. My name is Petra. I'm actually visiting here from Toronto. I'm really appreciative to be in a space like this, which is by us and for us. And just before I get into my presentation, just a bit about me. By the very repetitive acronyms beside my name, I am a social worker by background who's worked majorly in mental health focused roles. But right now, I work as a patient and family relations specialist with Sick Kids Hospital. And my specialty in the office is as a Black health and inclusion liaison, which I'll speak more about throughout my presentation. So just for the agenda, I'm just going to start off talking about the role and some organizational background, and then I'll provide some examples of what we've seen in our office and the mental health effects of these experiences on patients and families, and then get into the complaint process. So for those of you who don't know, Sick Kids is located in downtown Toronto. It's the largest pediatric hospital in the country and the most research-intensive one as well, serving both local patients and international patients through our international patient program. So the department that I'm under is the Patient and Family Relations Office, which is responsible for managing feedback from patients and families that are both positive and negative. And we also get feedback from staff regarding families. So our team consists of 4 specialists, including me and an intake coordinator. In terms of culturally specific roles, we do have another specialist who works as an Indigenous health navigator. And then there's me who works as a Black health and inclusion liaison. So my role includes different responsibilities, including providing a safe space to listen and support Black and equity deserving communities, also providing education and coaching to staff, and consulting on hospital-wide initiatives using an EDI lens. For the purpose of this presentation, I'll be speaking about discrimination-related complaints that we've received from Black patients and families. But next, I'll give you some background behind my role. So this role was implemented last spring, and it was a result of, in the past few years, our office seen an increase in numbers of concerns regarding discrimination and racism, where a third of them came from Black patients and families. So despite this increase in representation in these types of complaints from Black patients and families, there was actually no one in our office who was Black. So my manager saw that there was a need to hire a specialist to support Black patients and families for the sake of the safety of these patients and families, and to ensure that investigations are handled in a culturally sensitive way and with expertise as well. So pediatric centers are unique in the way that even though the child is being treated, also the parent or the caregiver is also being treated and assessed as well. And with elements such as implicit bias, power dynamics in healthcare, and also that layer of surveillance, racialized families are at risk for having negative experiences when accessing healthcare. And this is further exacerbated by certain social determinants of health and also intersectional identities. So I just grouped here some themes that we've seen in terms of complaints from Black patients and families. And for the sake of time, I'll just highlight a few of them. So pain bias, where we've received complaints where patients have received a delay in medication administration for pain medications, also a delay in treatment where that was due to the fact that they weren't believed to be in as much pain, and also due to the presentation of Black children. I was actually speaking with a mom 2 weeks ago who shared that due to the way that her son presents as older than he is, it's not believed when he expresses that he's in pain. CAS reporting as well has been complaints that we've received, and we know that for Black patients and families, this is very traumatizing. And of course, being a pediatric center, there is a bridge between us and child welfare, and we actually do have a department in our hospital dedicated to that called SCAN. And then the last example that I would like to highlight is about behavioral responses, where when Black patients or families have expressed certain emotions, they were met with either being framed as a difficult parent or aggressive parent, or had code whites called on them, or security. And in a hospital setting, the definition around appropriate or respectful behavior does not take into consideration trauma and cultural ways of expressing yourself, where if someone speaks louder or uses their hands or move, those can be misinterpreted as signs of danger or threatening behavior. So we know that these are complaints, but they're also trauma for these patients and families, and they have significant psychological effects for them. So some of these effects include vicarious trauma, where even though a situation is happening to the patient, it's also impacting the caregiver as well, and vice versa. We've also seen low self-esteem, where people have started to question their sense of value and worthlessness and worthiness due to how they were treated. Hypervigilance as well, where we've seen patients and families requesting their health records, also recording during visits. I was actually in a meeting before where a mom, due to the amount of trauma she's experienced, she actually pulled out her recorder and let us know that she's recording, and asked for everyone to say their full names just in case something went wrong. We also see avoidance, where sometimes families don't want to return to our hospital, or they leave against medical advice. And a lot of patients and families who have gone through these different experiences have experienced fear or mistrust to the system and to our hospital. And we recognize that some of these effects are brief, sometimes they're temporary, and sometimes they're chronic as well. And just like a little story, the oldest patient that I've ever worked with was actually a 60-year-old man who experienced something when he was a child, and he was holding it in for decades. And he only contacted us this year after seeing one of our commercials that triggered a flood of memories for him. So even though this is a department around feedback, it's also a way for patients and families to seek redress around the harm that they've experienced. So I really like this African proverb, which states, "Until the lion tells his side of the story, the till of the hunt will always glorify the hunter." And I really like this quote because it demonstrates fairness. And many times the stories we hear in healthcare are authored by the staff, whether we hear these stories in meetings, the medical charts, the safety reports, they're all authored by staff, and our office has the privilege of hearing the perspectives of patients and families. And when we do that, we're privy to information that we didn't know from before, and it also shifts the accountability from the patient and family to the onus on the organization in terms of our problem areas. So our complaint pathway can be split up into 4 stages. First, we gather information. So this is understanding, assessing, and listening to families for feedback and desired outcomes. Then the next stage is investigation, where we analyze relevant sources. So this can be the medical charts, safety reports, policies, and practices to see grounds as to why something has happened. And we also share this feedback with leadership for review, and we review this with the involved staff. So in those meetings, we ask questions such as, why did you see this family as threatening? What were your grounds for reporting? What is the standard of care, and how did you deviate from that? Why did you deviate from that? And then the next stage is information sharing, where we go back to the families and share the outcomes of investigations. And sometimes families are so traumatized by the interaction they had that they actually don't want to come face to face with staff or speak to them again. So in my role, I just share the outcomes with those families. And then the next step is that we also want to be preventative. And there's another African proverb which goes, don't look at where you fell, look at where you slipped. So we like to go back into cases and see what led to these interactions and how can we improve our approaches moving forward. So we provide education and coaching to staff. We also review policies and practices. For example, right now I'm working with protection services to look at their policies around how they stop individuals and how they screen individuals who they deem as suspicious or harmful. And then we also escalate concerns to relevant leadership if there's a need for institutional change. So this office and this role has been beneficial for patients, families, staff, and the organization for different reasons. Families feel very empowered by being able to come into our office, and a lot of them have guilt around the fact that they weren't able to speak up in the moment. And they also are agents of change, where when they do raise concerns, there's a domino effect of change after that. And it provides an opportunity for reconciliation between these families and the hospital and staff. And for staff, it promotes accountability, which is why we get their leaders involved. We just don't tell the staff directly about the feedback. We make sure that their manager knows, we make sure the director knows as well, so that there's that oversight. And through education, through coaching and these discussions, we're able to build staff's capacity, awareness, skills, and knowledge as well. And it results in a more safer organization that's trauma-informed as well, and where racism and discrimination is not a taboo topic. So the key takeaways is that Black patients and families have unique experiences and negative experiences due to prejudice, racism, and bias in healthcare. And this is further exacerbated by their social determinants of health and their intersectional identities, which has effects on their mental health. And it's very important that organizations implement mechanisms of accountability and interventions to benefit both patients and families, staff, and promote an organization that's safe and equitable as well. And it's also important to have culturally specific and special pathways for certain groups to ensure that their diverse needs are met and that they feel safe as well. So I'm just going to end off on this quote by James Baldwin, which states that not everything that is faced can be changed, but nothing can be changed until it's faced. And this is a collaborative effort to address racism in healthcare. And I'm really appreciative of all the presentations that has been happening. And it really shows that this can't be done in silos. So yeah, that's the end of my presentation. Thank you.